Check for respiratory symptoms such as a cough and runny nose. Since coronavirus is a respiratory infection, cough and runny nose are the most common symptoms. You may have a cough with or without mucus. Notice if you have a sore throat along with your cough. Coronavirus also causes sore throat, so this can be a sign of an infection. Typically, sore throat appears early in a coronavirus infection and isn't caused by frequent coughing, so consider when your sore throat began to see if it might be caused by coronavirus. Rest if you're having a headache, body aches, or general fatigue. Similar to other respiratory infections, coronavirus may cause a headache, body aches, and fatigue. Generally, you just won't feel well. These symptoms could be a sign of coronavirus if you also have other respiratory illness symptoms. Take your temperature to see if you have a fever. Since fever is a common symptom of coronavirus, always check your temperature if you're worried you contracted the virus. A fever over 104 degrees Fahrenheit 38.0 degrees Celsius could be a sign that you have coronavirus or another infection. If you have a fever, call your doctor to discuss your symptoms. Watch for breathing problems or shortness of breath. Coronavirus can cause trouble breathing, which is always a serious symptom. Contact your doctor immediately or get emergency medical care if you're having difficulty breathing. You may have a serious infection, such as coronavirus. Call your doctor if you suspect you have coronavirus. Tell your doctor that you're having symptoms and ask if you need to come in for an exam. Your doctor may recommend you stay home and rest. However, they could ask you to come in for lab testing to confirm your infection. Follow your doctor's instructions so you can recover and are less likely to spread the infection. Undergo a lab test for coronavirus if your doctor recommends it. Your doctor may do a nasal swab of your mucus or a blood test to check for an infection. This will help them rule out other infections and possibly confirm coronavirus. Allow the doctor to take a nasal swab or blood draw so they can make a proper diagnosis. Get emergency medical treatment if you have shortness of breath. Try not to worry, but a serious coronavirus infection can cause complications, such as pneumonia. If you're having trouble breathing, go to your doctor, an urgent care center, or an emergency room immediately. If you're alone, call for help so you arrive safely. Stay home so you won't risk infecting others. You're likely contagious, so don't leave your home while you're feeling ill. Make yourself comfortable at home while you recover from your illness. Additionally, tell people that you're sick so they won't visit. Rest so your body can recover. The best thing you can do for yourself is to rest and relax while your body fights the infection. Lie down on your bed or your couch with your upper body propped up on pillows. Additionally, keep a blanket with you in case you get cold. Take over, the counter pain and fever reducers. Coronavirus often causes body aches and fever. Fortunately, an over-the-counter medicine like ibuprofen, Advil, Motrin, naproxen, Aleve, or acetaminophen, Tylenol will help. Check with your doctor to make sure it's safe for you to take an over-the-counter pain reliever. Then, take your medication as directed on the label. Use a humidifier to soothe your throat and airways. You'll likely have a sore throat and mucus drainage, and a humidifier can help. The mist from the humidifier will moisten your throat and airways, which can relieve your sore throat. Additionally, the moisture will help thin out your mucus. Consume lots of fluids to help your body heal. Fluids help your body fight off the infection and thin out your mucus. Drink water, hot water, or tea to help keep you hydrated. Additionally, eat broth-based soups to increase your fluid intake.